Hello friends, today we are going to discuss about the Guillain-Barre syndrome. You may have heard of the syndrome because now an outbreak is there in Pune, Maharashtra, and about 101 or 110 cases have been, 110 cases have been, almost 110 cases have been reported. And what do you mean by this Guillain-Barre syndrome? It is actually a disorder in which the immune cells of the body will affect the peripheral nervous system. So what is happening is the immune cells will affect the nervous system, peripheral nervous system, that will give the signals to the muscles, and the disorder is characterized by the muscle weakness. So coming to the symptoms of Guillain-Barre syndrome, the symptoms of the disease are: the first symptom which will be appear in the patients is the tingling sensation or the numbness in the legs as well as the feet. If it is treated not properly or if it is unnoticed, then this can lead to respiratory weakness or respiratory muscle paralysis, and finally the patients has to be admitted into the hospital for emergency care. It can be life-threatening in nature. And what can be the cause of the particular disorder? The main cause of the disorder is Campylobacter jejuni, and that is responsible for this outbreak. Now the outbreak is also due to this Campylobacter jejuni. Other virus and bacteria can also, Zika virus, Epstein-Barr virus, then cytomegalovirus also can cause the particular disorder, Guillain-Barre syndrome. Then how we can diagnose the particular disorder? In order to diagnose the disorder, we can find out the deep tendon reflexes. We can examine the diminished or loss of deep tendon reflexes. Along with that, electromyography or lumbar puncture can also be done in order for the diagnosis of the disease. Then there comes an important point which all should be known, is the treatment of the disorder. The treatment of this Guillain-Barre syndrome is somewhat expensive because since this has one autoimmune nature, the treatment is always plasmapheresis, which is a technique in which the plasma exchange is done so as to get rid of the antibodies that causing destruction to the nerve cells will be done. And also immunoglobulins can be administrated, and this treatment is somewhat expensive in nature. Besides that, gabapentin will also be given, and after, if the symptoms are treated properly in the beginning, as the symptoms arises in the beginning time, if we are treated properly, then we can get rid of the disorder. There is no chance of this severe cases. There will be no chance will be there if it is treated properly in the early stages, if it is diagnosed properly in the early stages. So rehabilitation can also be done, physiotherapy can also be done to prevent because muscle paralysis will be there as a result of this disorder. So that also can be done. So please, the main reason for the spread of the disease, or the main reason causing the disease, is as I told you, as we mentioned earlier, is due to campylobacterial infection, and this can be due to the administration of contaminated food, water, if proper vegetables are not cleared properly, even meat is not cooked properly. All these can lead to contaminated water. All this can lead to the disorder. So take rest, be aware of the disorder. Then new studies are also conducted about this disorder, that is as a result of COVID-19, post-COVID also there is a chance for Guillain-Barre syndrome to occur in some patients. Besides this bacterial and viral infection, studies are also there. So be safe. This is a condition which should be carefully monitored and which should be carefully treated. So as soon as if you have any symptoms such as tingling, numbness or weakness, please do go to the hospital and please do done the diagnosis test and take the treatment as soon as possible. Stay healthy. Thank you so much.